Thank you, Doctor. I'm equally excited to be here at the Doctalk show. I know usually our viewers are used to having Dr. Joseph, Dr. Gavin, but this is a special show, like my colleague has mentioned. And as he has introduced, we are going to share and answer a lot of questions from the community around HIV/AIDS.
Thanks, Lazarus, for that introduction. And before we go to the question series, we just want to have some highlights onto some of those achievements that we have seen or we have all contributed to for the last 40 years. And to start with, I just want to share the fact that all these efforts have resulted into having more than 89% of people who are HIV positive being on treatment. That's one of the biggest achievements that we have pushed so far. And in Uganda specifically, at the moment, we have about 1.4 million people that are infected with HIV. And among these, we have about 1.1 to 1.2 million people on ARVs. And that is no mean achievement. Where we started from, we could say there was no treatment at all. And through efforts that government and other stakeholders, including our partners, that we have put in now, we have less people dying, and we have less people having severe illness because of enrollment onto the treatment. So I want to appreciate especially those individuals and clients that have actually committed themselves to taking these drugs, because it is that has sustained the drive, especially for HIV prevention. Because right now we know that drugs themselves not only prolong life, but they also support in the prevention of HIV. I think as part of this series, we want also to share with you facts on what is happening in the area of prevention. It is true that now we have all at least heard about how HIV is prevented. And a lot of us in the different backgrounds and communities have been reached by messages of how HIV is transmitted. I just want us to appreciate that those messages remain the same. We need to keep reminding ourselves that HIV is there, and HIV continues to be spread through the same routes. Now, what is working so well? We need to use that information correctly, and then we need to be able to pass it on and keep reminding ourselves and not get tired. The other issues around prevention that are key to us to appreciate that we have, beyond the ABC strategy, that is the abstinence, the condoms, the being faithful, other measures that have actually proven themselves to be successful. Among those measures, the voluntary medical male circumcision, that is available almost at all service centers, both by Ministry of Health and also other partners, including Tassel and other private facilities that are providing this service. The other prevention measures that are available are what we routinely refer to as drugs used for prevention. And currently we are enrolling some special groups on certain drugs we call PrEP, which are actually effective in preventing transmission of HIV to a very great extent, as we shall be discussing later. So that is around prevention, and I want to always insist that for all diseases, the best approach to managing them is actually for us to prevent ourselves from getting infected with diseases. And now specifically for HIV, I just wanted to re-echo that message so well. Now, in the area of testing, we have been very successful. I remember in the beginning we could spend almost 2 or 3 weeks waiting for HIV results. And at the moment, I confidently can assure you that you can actually get an HIV test in your own living room, and you can do the tests on yourself. In the public facilities and all other testing centers, you can have very quick tests available to you within a period of about 30 minutes. It's almost instant. So there is actually a very good reason now for you to be able to get an HIV test, because it is quite affordable and quite easy. Affordable, I mean it is actually for free. So that's in the area of HIV testing. That's the success that we have made. In the area of treatment, I think I had already earlier alluded to it. The success on treatment is tremendous, and we are now ensuring that everyone who is not on treatment actually is able to be tested and then enrolled on treatment on the same day. And this is quite an exciting phenomenon that I just wanted to share with you on this specific show. So with that, I think I just want us to be prepared for some of the key questions that you as the community raised. These questions, we are excited to answer them, and we are very happy to be able to give you as much information as possible. And I and my colleague will be going through a number of them. So at this particular moment, I think I will allow him to talk about himself a little bit more, such that he will lead into the bigger discussion. You're welcome, Lazarus.
Thank you, Doctor. I introduced myself earlier on, Lazarus Ouchul. I work as the Technical Advisor for Prevention Services at Tassel. Many people out there know me as Uncle Laz. Now, Doctor has talked about the World AIDS Day, where we are as a country, and what different interventions that we are having as a country. Now, I'm going to share a little bit more about Tassel and what we are doing around the World AIDS Day activities. So many people out there, like one of the questions that came in, is Tassel still in existence? Yes, Tassel is still in existence. We celebrated 34 years of existence. Tassel is the first national AIDS response to HIV in the country. And we have cared over 200 people living with HIV as a country. And we have 11 centers that are spread all around the country. And in these 11 centers, there are different activities that are going on currently. Now, Tassel is also in health systems strengthening. We have 3 projects, one running in Soroti, another in Southwest, in Ankole region, and recently we are starting one in Acholi. So in the health systems approach, we are supporting the government, the national systems, and we are helping the public health service, public health facilities to provide HIV-like services, comprehensive HIV services. So in all these projects, there are different activities that are going on. One is sensitization on GBV. We all know that GBV is a structural barrier to prevention and treatment. We are also having radio talk shows in the different regions and in different service centers that we are having in the country.
This World AIDS Day specifically, we are looking at ending inequalities among those that receive services. We are also working together to end other pandemics and using the experiences we have gained and eventually having HIV come to an end. And this is a reality. The global community made commitments to end HIV by 2030. And with the leadership of UN AIDS, we made bold statements that include what we commonly hear as the 95, 95, 95, and that means that 95% of individuals in the community that have HIV know their status, that they actually have HIV. The other 95 is that 95% of individuals who know their status are actually on treatment, and then the other 95 stands for 95% of individuals on treatment actually have a suppressed viral load. We have made progress, like I have mentioned earlier, on each of those fronts, and for Uganda specifically, we have enrolled at least 89% of the population that has HIV to know their status, and this is UNAIDS information by 2019, and of those we have 90% of them on treatment, and about 90% of them have a viral load suppression. At least that achievement is progressive. Now, the number of issues that are still standing in the way of moving forward to achieve that target. And I want to state that this World AIDS Day reflection needs to help us to come to a common understanding, but also devise ways in which to overcome the barriers for us to get there. And I appreciate all the efforts of all the players that are pushing through to see that we move forward in the right direction.
You are watching the Doctalk Show.
Transact and win money after money with Airtel Money. 1.5 billion shillings in cash prizes up for grabs. The more you transact, the higher your chances of winning. Airtel Money. Instant, secure, borderless.
You are watching the Doctalk Show.
Welcome back. We are going to our second segment. Like we earlier on mentioned, we have a couple of questions from around the country. As part of commemoration of World AIDS Day, we are going to answer some of these questions. There are so many, we might not be able to finish all of them, but we'll try to make sure that we answer as many as possible. So our first question is it possible for a discordant couple to have a baby? This is where we have one partner is HIV positive and the other partner is HIV negative. So discordance exists. We have so many couples that are in this scenario. We have a number of clubs where we support discordant couples to live together. It doesn't mean that when one is negative, that is the end of the relationship. In the next show, perhaps if it is possible, we'll be having a testimony from couples who have gone through this. And they will share how they have been able to go through this kind of situation. Now, there are so many advances that have happened, and I know we shall answer that ahead. But one of it is that we have an intervention that is called pre-exposure prophylaxis for people who do not have HIV and they are at risk of getting HIV. This negative partner is put on treatment. It is a combination of antiretroviral drugs, and it will prevent this negative partner from getting HIV. And we are going to discuss this in detail. I know the next question which my colleague is going to discuss is how is this possible? And this is to do with prevention of mother-to-child HIV transmission. So, Doctor, there is another question related to this, is that we are planning to get a child. Is this possible for us to give a birth to a normal, healthy baby?
Okay, thank you so much. I think that is a very important question because increasingly our HIV positive friends and family are living a healthier life, and they have normal life expectancy with normal life expectations. So having children is one of those things that each and every one of us aspires as we pass through adulthood. And it is very possible that an HIV positive person can actually have an HIV negative baby. Since 2010, we have been running a very systematic program that has grown very well, and this program is aimed at prevention of mother-to-child transmission of HIV. It has also transformed into what we call elimination, because when we talk about elimination, we mean actually it is possible that every mother can have an HIV negative baby. Now, how does this work? How it works is that a mother must know her HIV status for her to be able to prevent HIV from getting her baby. If you don't know, then the chances are high that actually your baby will pick HIV. So the first step is in knowing. Every mother that is pregnant must know their HIV status, and this program is running as a nationwide program. Now, once you know your HIV status, then we take you through a series of processes that actually help us to make you achieve the goal of having a negative baby. This starts with one of the key principles that we want to share, and that is when you take ARVs, the ARVs actually stop, reduce the viral multiplication, and therefore the virus in your body is not available to be transmitted to the baby. And I want you to take note of that, because one of the key interventions that we do as part of prevention of mother-to-child transmission is once we find out that a mother is positive, then we enroll her immediately on the same day on taking ARVs for prevention of HIV transmission to the baby. These ARVs are initiated early in pregnancy, and I want to use the word early because it has to start as early as possible. And this mother will take these ARVs for the rest of her life, because for her own good. And for the baby, we usually encourage that this baby is taken care by the mother in the normal framework. We'll breastfeed after delivery. We'll take some drugs after delivery as recommended. And eventually, after 1 year of breastfeeding, this mother actually will have an HIV negative baby. I know this is not enough time for us to answer everything around prevention of mother-to-child transmission, but when you come to a facility and you are tested as an entry point, you will go through a whole comprehensive process of having an HIV negative baby.
Thank you, Doctor. And a similar question related to that is, hello, Doctor Shaw, I'm HIV positive. How do I get to let my partner know? This is a very interesting question. And I can sympathize, I understand. It's a very difficult situation. Similarly, a mother, related to what doctor has just gone through, a child grows, and it will reach a stage where the mother has to let the child know that you are living with HIV. That is, if the child was unfortunate and got HIV. It is also a similar situation where we are grieved, where we have lost someone. We do not know how to break the bad news. Now, I want to tell the listeners out there, this is very possible. With the trained counselor, he is able to support you disclose your HIV serostatus to your partner. We have programs as a country. We call it assisted partner and notification. We have counselors that have been trained to do that. They would be able to take you through and support you on how to disclose your HIV serostatus to your partner. The best desirable scenario is actually you yourself to disclose your serostatus. So the counselor will empower you, give you the different techniques of how you can disclose your serostatus to your partner. But if that is very difficult and there is a risk of gender-based violence that I talked earlier on in the introduction, then the counselor would assist you to break the news of your serostatus to your partner. Related to that, doctor, there is, my colleague will answer, is it safe for someone living with HIV/AIDS to get COVID-19 vaccine?
Oh yes, I think that is a very interesting one, especially in these times. But just before I go to that one, I think I just want to also add some voice onto the question around partner disclosure. I want to also emphasize what Lazarus has talked about in relation to disclosure, and emphasize that it is common that when you're tested HIV positive, you're actually afraid and you think a lot is at stake, you can't disclose to anyone. You will manage by yourself, and that is a normal response. What I would want to state is that it is easier when you share the burden with other people, and disclosure is one of the processes that will help you achieve the best outcomes of starting your journey on treatment as an HIV diagnosed person. And the process of disclosure is not a one-day event. It is something that you can walk through yourself, but also with the support of your caretaker, like Lazarus has mentioned. And it is something that is of very important value for you as a person who is starting treatment, that at least within your family and your very partner, they get to know what your situation is and how well you need to move through it. So now I'll come back to the question that was asked. I'm not sure where this question came from, but it's really around vaccination and COVID and HIV. I will just straight away state that it is very important that an HIV positive person gets vaccinated, and it is beneficial and it is of no risk to you, and getting the vaccine actually protects you from getting severe COVID-19. And when you have HIV, it has no effect for you to take the vaccine. So I want to just start my discussion with that very example. We have very many colleagues and clients that have received vaccines and have been protected from COVID-19. Now, since the coming of COVID-19, there has been a lot of challenges, and especially myths around who should get vaccinated, who should not get vaccinated, how about this effect, how about that effect, and does HIV actually also affect, does COVID-19 affect HIV positive people? Those are very many questions around. I just want to allude to some of them and state that yes, you can still get COVID-19 when you're HIV positive, and vaccination will help you as one of the measures. You follow the rest of the other COVID-19 infection prevention measures, and wearing a mask, washing your hands is very important in this circumstance as it is for everyone else. When it comes to vaccination, there are no special requirements. You do not need to you don't need any special tests, you don't need any special circumstances. And as an HIV positive person, just walk to your vaccination site and ask them to vaccinate you. But however, when you're sick, like you have a fever or you have other illnesses, you're on TB treatment, it would be ideal that you first complete your other treatment and you don't get vaccinated when you're having other diseases that are disturbing you. But for as long as you're living healthy and you're able to get a vaccine, please go and get your vaccine, because it will protect you. Some patients who have HIV actually are at risk of getting a much more severe COVID-19 infection than the general population. And some other individuals don't agree with that, but for now, what I can reassure you is that the vaccine will protect you from severe infection. I think the country is rolling out vaccination as a whole, and whichever public health facilities that you move to within the areas where you live, the vaccines are available. There are different types, and they are available for you. And right now we are vaccinating from 18 years and above, and anyone can qualify to get the vaccine, and it would be good that each of us gets a vaccine.
Thank you very much, Doctor. Please, if you are living with HIV, go for vaccination. We've come to the end of that segment. We are going for a short break. When we come back, we shall continue answering many of your questions that we have here.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back from the break. We've had a lot of questions flowing in. Please let the questions come in. One of the questions is again in the angle of prevention, and this is from Robert from Lira. He's asking, is PEP effective in prevention from one contracting HIV/AIDS? Yes, Robert, this is very possible. And for the benefit of our listeners, PEP is an acronym of post-exposure prophylaxis. It means one has been exposed to HIV, and if you've been exposed to HIV, it is possible for you from getting infected, so long as you come for this intervention within 72 hours. Beyond 72 hours, it might not be possible to prevent you from getting infected with HIV. Now, there are different people who either accidentally get exposed to HIV. For medical personnel like us, through accidental needle prick, it is possible that you get exposed to HIV. Other individuals, for example, through rape, and you do not know the serostatus of the other individual, you're most likely to get infected. So it is possible to prevent you from getting the infection. So this is what we call post-exposure prophylaxis. You'd be put on treatment for 1 month, but before you are put in treatment, we have to rule out that you are actually not infected with HIV. So you have to be tested for HIV, and if we are able to get the other partner, we have to rule out whether the other partner does not have HIV. There are many other things when you come that we subject you through before we actually put you on post-exposure prophylaxis. So Robert, that is very possible.
I think I have a question that is very, very interesting, and someone is asking whether HIV is curable. And that question always arouses very interesting thoughts in my head. And before I go straight to it, I think I just want to make one clear statement that at the moment we do not have any drug that cures HIV. We have, however, made progress in the different treatments that prolong the life of a person that has HIV. The drugs that are available for HIV have gone through several processes of development, and at the moment there is good news that you have a drug that you can take once every day, which is a big contrast from what was there in the beginning, where individuals used to take a multitude of drugs and very many times a day. And now the available drug, especially recommended in Uganda, that is provided for treatment of HIV, is a one pill that you take every day at least once. That has improved our adherence, it has improved our timing, and if I'm taking one drug every day, then my life is possible without any discomfort. But in reality, you need to stay on this drug and on this medication for as long as your life is with you, and it is what we recommend that you do without interruption. Now, some of these drugs that we take give us a very good feeling after we've taken them for a long time. Your life is healthy, you're normal, and you actually start to feel like you are without HIV. We do tests that keep checking for the level of the virus in a person's blood, and sometimes the results we give our clients that we show the virus is not detectable. The interpretation is that the virus is not multiplying because the drug is working, but it does not mean that you have cured. So I encourage each and every one of us that is taking our drugs to continue taking our drugs, and even when we say the virus is undetectable, you actually congratulate yourself and continue to take more drugs, because the moment you stop taking the drugs, then the virus will start multiplying again. And when it starts multiplying again, then we start to feel unwell and then go back to a high level of the disease in our blood. Now, the risk of stopping drugs definitely is what we call resistance, that when you stop them and the virus becomes mutated or it changes its form into another virus, HIV virus, that is not responsive to your drugs, then you actually run a risk of running out of drug options for you to continue to stay alive and healthy. So it is very important that we take this message and appreciate and support our colleagues, support ourselves to see that we do not get derailed, we do not get convinced and deceived that we have cured from HIV, because it is currently not possible in our framework. However, the hope in the future, and a lot of work is going on, we are actually working towards other modes of prevention, and including a vaccine that are likely to be available in, I'm optimistic about that. And since HIV coming into our communities, we have been fighting for development of vaccines that have so far failed to be effective. But the good hope for the future is that a lot of work has become available, has gone into this, and I'm sure that in not a very, very far future, we can have this come to life. So that's, I want to summarize the question of cure with that. I think we will take on the next question, and I think this, my colleague Lazarus will answer it. And is it possible for one to test for HIV without taking a blood sample, and how effective is it?
Thank you, doctor. I guess that person fears a needle prick. And I want to say it is now very, very possible. Like my colleague mentioned earlier on, we've come a long way. When I was young, it would take about 2 weeks for you to get or to know your serostatus, to know your results. But these days, it is very instant, and you can do it yourself. This is what we call Hiv Self Testing. There is a kit that you can take, follow the instructions that are in that pack, and you'd be able to take a test. You wait within 15 to 20 minutes, you get your results. Now, as per the guidelines from Ministry of Health, if the test is positive, you need to go to the nearest health facility or work with the peer that could have given you the test kit to go back to the health facility to confirm whether it is a true positive. But if it is negative, that is it. That is okay. It is possible, and for now, it is not available for the general public. There are guidelines, there are populations that we normally distribute these self-test kits for them to ease. These are the populations that find it very difficult, for example, to come to the health facilities. Partners of pregnant women, they find it very hard to come to the facilities. So sometimes we give the pregnant mothers to take the kits to their partners who are so busy to come to the health facility to take a test. There are also other groups that are at a very high risk. I think I will talk about these groups perhaps later on. There are very few probably testing facilities, so we can give these kits to the fisher folk to distribute so that they are able to know their serostatus. There are also other groups that are at a high risk. For example, sex workers. These kits are available for them. They would be able to instantly test themselves without necessarily coming to the health facility. So yes, it is very, very possible. And the question is it effective? Yes, it is very effective. Before it is released, these kids undergo severe rigorous testing to validate whether they are able to do this. And by the time the Ministry of Health approved this, it had been piloted and it had been found to be able to detect the HIV that is in the saliva that you use for testing it.
Yes, that is quite an interesting one, because I think many people would wish to be able to access this test within the comfort of their homes and be able to test themselves, but also their partners. And I want to encourage you to learn about this, because it should be an opportunity for us that are not able to quickly access health services at a health facility to be able to use this test to know our status. Now, the other question that came in was about herbal medicines, especially with HIV. Can I take my herbal medicine as an alternative to treatment for HIV? And I think I know we have made very many years in progress in treatment, and before that came, our lives were dependent on herbs, and we have individuals that find this very comfortable. The herbs that are on the market are not for HIV treatment, and I would want to state that many of the herbs that we've been taking are not proven to be treatments for HIV. The current proven medicines that can be used to effectively control HIV and prolong a person's life and give a person a good quality of life are the drugs that have been approved by the relevant approval authorities, both nationally and internationally. And the drugs that are available, the ones we call ARVs, have been tested to be effective in doing this job, unlike some of the herbs. I don't know so much about herbs, but I speak about them in general. Some herbs that are available in Uganda and in other places are mostly supplements for either nutrition or supplements for some form of multivitamins, and some of them also are known to treat other diseases other than HIV that can affect a person who is HIV positive. And traditionally we have treated diseases like malaria, we have treated symptoms like headache, we have treated many other symptoms with herbs. And the question I now want to divert a little bit much more into is whether it's actually safe for you to take your drugs for HIV, that's ARVs, at the same time taking herbs. I think it is a relevant question, especially in line with this very one that we have talked about. And I just want to once again state that you cannot stop your ARVs and then take herbs in their place, or you take herbs in a place of ARVs. That is not right. However, some people may ask, can I take my herbs on the sides as a supplement or as some form of adjuvant to my ARVs? And many herbs, like I said, that are nutritional based, especially we have some others that have been packaged even as capsules, multivitamins and so many other things. Those are fairly okay. There are herbs that we have known that when you take them at the same time with ARVs, they are likely to affect the effectiveness of ARVs. So you check the drugs that you're taking and speak with your healthcare provider where you pick your ARVs from. And if you're planning to take any herbs, if you're already taking some herbs, you be open to a discussion with your facility where you get your drugs, such that the health worker can double check what you're taking together with your ARVs and make sure that your drugs are not being affected by this specific medicine that you're taking from the alternative perspective. I think that would be the safest way, and I encourage you to best take care of your life by being proactive with especially combining. And it's not only ARVs and herbs. In that very light, I also just want to mention, while you're taking ARVs, because you're taking them for life, you need to also appreciate that the other drugs that you buy on the market for other diseases, like you have an infection, as it is stated these days, you have a headache, you have high blood pressure, you have other diseases. Before you take those drugs, you disclose to your health worker that I'm actually taking ARVs, such that that health worker can determine whether there is an effect of one of these drugs on your ARVs. That is very important, because the moment you don't do that, then you are going to cause an effect on your ARVs not to be effective. I think that's a very important discussion. Thank you for that question.
So thank you, Doctor. There are more questions that have come in, but before we go into them, we want to go for a short break. When we come back, we shall answer them.
You are watching the Doctalk Show.
Did you know that corruption cripples Uganda's development? It's time for you and I to put an end to this. We can work together to end corruption. Let it be your responsibility to report to the established anti-corruption agencies. A corruption-free Uganda starts with you and I. Your right, your role. Say no to corruption. This message is brought to you by the State House Anti-Corruption Unit.
You are watching the Doctalk Show.
Now, before we went to the break, there is a question that came in, I think, in relation to HIV self-test kit, that why don't we give the HIV self-test kits to everybody, and why did I concentrate on the special populations that I mentioned? Now, the self-test kits are very expensive. Generally, HIV testing is very expensive. My colleague mentioned that over 90% of the population now knows their serostatus. They are just pockets. There are just a few subpopulations that do not know their serostatus. So it would be very wasteful for us to distribute the HIV self-test kits to the general population. So the rationale, therefore, is that the self-test kits are targeted to these specific groups that we think are at a very high risk of HIV transmission. Now, the next question is related also to what we had answered earlier on, that is to do with discordance. This person is asking, is it possible for a negative partner to get married to a positive partner? Yes, this has happened. I particularly have attended over 5 weddings of people who are discordant, and what is key here is disclosure. And that is why, as we mentioned earlier on, that it is very important that the HIV positive person discloses his or her serostatus to significant people in his or her life, including the partner. So in case the couple wants to get married, it is possible. They can be supported by the counselor to know what to do in such a relationship, and how a negative partner can actually support a positive partner. And in case they want to have children, what can they do to make it possible that they get the children? Now, on the other angle, if that is not done, you do not disclose the serostatus. Somebody was asking that, isn't this criminal? Isn't this illegal? Yes, the AIDS control bill puts it that if someone maliciously transmits HIV to the other, this person can be prosecuted. So that is illegal, that is immoral. But where individuals are open, they have shared their serostatus, there is nothing wrong. And like I've mentioned, many partners have gone ahead. I also know that in some churches, it is mandatory that before the church proceeds with the wedding, you have to prove that you have taken an HIV test. Where a discordant result happens, they discourage such a relationship to go on. Or the parents themselves will say, no, this is not possible. But remember, the marriage is between two people. So if these two people have agreed and they want to continue with such a relationship, it is their decision. That's why I mentioned that they need a support of the counselor, because there are implications if they want to continue with this union. And like I mentioned, the counselor will take them through what they need to do if they want to continue with this relationship, so that they prevent the negative partner from getting HIV. Or if they want to get children, we have already discussed that. The counselor will support them on what to do so that they are able to get HIV negative children. But the decision to stay with the negative or positive partner is the decision of the two people.
I think that leads me into the next part of the discussion, and another very interesting question. This is around testing, and why is it important that a person conducts an HIV test? I think looking at that is, I will approach it in one way that is very important to me, and I think to all the other service providers, that knowing your HIV status is in your own best interest. And how does it work? These days, with drugs available freely and within the nearest possible point from where you live, when you know your HIV status, before you even get sick, you can start treatment. What does this mean? The moment you know your HIV status and you start treatment, I am confident and sure that you will live a very normal life expectancy. So it is in the best interest of each and every one of us to consistently determine our HIV status. Like if you tested 2 years back and you have been having risky or exposure, then you test again, because you need to find your status, you need to determine your status as quickly as possible, such that you may prevent yourself from getting sicker. Now, apart from just getting sick, and apart from living a normal life expectancy, there are other benefits of you knowing your HIV status. And among those, the moment you start drugs and you actually suppress the virus in your blood, it is now clear that you cannot transmit HIV to your partner. And I know this sounds very controversial, but the literature and the current understanding is that the moment you are HIV positive and you have taken your drugs and you have suppressed the viral multiplication, there are chances, it is very evident that you will not transmit HIV to your partner. And we use this even the mother-to-child transmission, like I alluded earlier. It's the same concept, but now here it is protective to your partner. As part of our drive to end the HIV epidemic, we need to have as many people that are HIV positive on drugs as much as possible. So at a community level, when most of us know our HIV status and those that are positive actually start their treatment early, then the chance of HIV being passed on within the community when we don't know is reduced. So that is the key message I want to push harder into our understanding, such that we get encouraged to get HIV tested as frequently as we get exposed to it, because it is important for our own lives, but also for prevention of HIV transmission to those that we care about. Now, the other element that comes in, especially with knowing your HIV status, is that actually you get your mind very clear about your yourself, and then your choices become, the choices especially around prevention and the choices around those that you care about become very clear to your mind. And like we stated a little bit earlier, it is possible that you can actually have very quick HIV tests And knowing your HIV status shouldn't take you a day, it shouldn't take you an hour. It is something that once you make up your mind, then you'll get to know. Testing is available at all public health facilities, all government hospitals now and clinics have free HIV testing available based on risk. Like you can't just test today, then test tomorrow, and test the next day just because you want to keep testing. You test when you know that there is a reason that you could have been exposed. So the moment you state that reason, then a test will be availed to you. And as that goes on, the moment an HIV test result comes out, usually the process of you appreciating your new status, if you're negative, you will receive information on how to stay negative, and if you're positive, you will be supported through the process of starting treatment. So that is the importance of getting to know your HIV status, and all this is for free, and that is the amazing part of it.
Yeah, thank you. And just to remind our viewers, there are 5 principles. Testing is confidential. Testing has to have your consent. So nobody will test you without your consent, because many people are asking. We talked about HIV Self Testing. Does it mean that these individuals do not consent? They do consent. Now, another question that came in, Doctor, is around TB. This individual is saying that I'm suffering from TB. Does it mean I also have HIV?
Okay, yes, that's quite a common misunderstanding. TB is tuberculosis, which is a disease that we know. It's an immunizable disease, which we have all, at least most of the people in Uganda have received an immunization against TB. But as we go through our environment, we pick up TB infection, and when we get TB, many times when we are vaccinated and immunized like they do when we are young, we do not develop active TB disease. Now, HIV, when it reduces our immunity, we are able to now have symptoms of TB. And I want to just state that most people who have TB are likely to have HIV, but does not mean that everyone who has TB has HIV.
Many people who are living with HIV at a very high risk of developing TB. And I think this is where the context, the question came from. But like Doctor exactly explained it, it does not necessarily mean that you are HIV positive. So the best thing to do is for you to go for an HIV test to rule this out. But I think this person got the information that everyone who has TB means he has what? HIV. It does not mean that. We've come to the end of our session. There are many questions. Unfortunately, we cannot answer all of them, but we can continue discussing this in other platforms. A call to action. Our World AIDS Day theme is ending epidemics, ending inequality, and ending AIDS. Now, as a country, we know that HIV is concentrated in subpopulations that we call as priority populations or key populations. Now, these populations are specifically the adolescent girls and young women. HIV epidemic, like we mentioned at the beginning of this special talk show, is the highest among the adolescent girls between 15 and 24 years. Compared to their counterparts, the boys, is very low, but the young girls at a very high risk of getting HIV. The other subpopulations, the sex workers, I know it is a discussion we've had for a long time, but sex workers is the other population that is disproportionately affected by HIV, and that is where we really need to concentrate to end HIV. And other populations, such as people who inject drugs, these are the populations that are at a very high risk of getting HIV. And we want them to access treatment, access testing, and that is why a lot of concentration is on these subpopulations.
Yes, thanks. And if we are going to end the HIV epidemic by 2030, as we have all committed ourselves, we have an obligation as government, we have an obligation as players in the field to ensure that we create the rightful environment for those that have been left out to receive care, to be able to come out and get supported, especially to get treatment. The legislations that increase the likelihood that persons that are affected with HIV do not come out and get banished, kind of make it difficult for them to receive care, especially in such a circumstance. And if we who are providing care for them come out and be in position to be open to them and ensure that they are able to access treatment, do our part, then the goal to reaching epidemic control and to eliminating HIV in Uganda by 2030 is very reachable, and it is a reality. We thank you so much for lending us this time and for interacting with us for the last couple of minutes. We appreciate you for these questions, and we thank you so much for stimulating this thought and discussion, and we look forward to another engagement. Thank you so much, and we wish you a blessed World AIDS Day.
Thank you. Thank you very much.